Hi, I'm Helen Farmer. If I'm looking a little slimy, it's because I've got the numbing cream on. Dr Jaffer Khan is joining us very soon. I'm here for some face art today. I've heard such amazing things about Dr Jaffer Khan, and I came to him for some Botox last year and loved the results. And as you can tell, you could you can plant carrots in here. So we are looking for a refreshed look. I want to look like I'm not a busy mum of two who gets up at 5 o'clock every morning. And because I lost quite a bit of weight recently, maybe just a little bit of more fullness in my cheeks. So what we're going to do today, really excited to see what the results are like, and we'll keep you posted.
Hello everybody, we have today our little discussion with Helen Farmer, who is a very well known Dubai celebrity. Anyway,
poor Dubai, if I'm a celebrity. I need your help.
Helen, tell us, how old are you?
How
young are you, I should say?
I'm 38, I'm 39 in July.
Yes.
I do get a bit emotional around birthdays. You know how some people cry on New Year's and like reflect on the year? That's me on my birthday. I cry every time. So if I can feel my best and kind of come in with a good attitude, I'd be thrilled. And we're all working hard right now. And I just feel like I look like I'm working very hard right now. So
Don't look as bad as you think.
Thank you so much. Well, let's see what we can do.
Weight loss.
So I lost about 45 kilos over the course of quite a while, and it's been great. I feel fantastic. I had a big health check recently, and everything is exactly where it should be, apart from my knees, which are screwed, but that's a separate topic. But it's definitely had an effect in terms of losing that volume on my face.
Okay, so if I were to ask you, and if you don't mind looking in the mirror, what things do you feel you could do to help rejuvenate your appearance?
Okay.
Okay.
This is pretty real.
Right.
And that's really just come on in the last couple of years, really.
Okay.
I use my face a lot for work, and I think I've just generally got quite an expressive face.
Expressive face.
So it's it's
So your
notable.
forehead lines.
Definitely forehead
Can
lines.
you frown, please? Okay, quite strong corrugators. Okay.
Yeah.
Can you smile again? And obviously a lot of expression around your eyes also. Now, if you don't mind to close the eyes tight, you see quite a strong downward pull of the lateral fibers of orbicularis. Right, now can you try to touch your lower chin to your lower lip to your top? Okay, so here we see quite an active mentalis muscle. You see a lot of dimpling and upward movement. And what else do you see?
I've definitely noticed a loss of volume in my cheeks, so this has dropped quite a bit. And as a result, I've got these lines that I feel are just quite aging in general.
Okay.
And I don't want to look 22. That's fine. I'm not interested. I just want to look like I've had a good night's sleep. And I want that weight loss to look like it's working in my favour rather than it counting against me.
Right.
Does that make sense?
Yes, it does. So in balance, after having spoken to Helen, we are going to do the following treatments. We're going to be doing some toxin, basically to the forehead, frown, around the eyes in order to achieve a small brow lift. We may evaluate putting a little bit of toxin in the chin, but we will see, because sometimes that has a potential side effect linked to it, which I will discuss in more detail with her. In terms of her mid-face, hold up with the camera. Okay, we will try to, again, put some volume in the lateral fat compartments here to give a lift. We will possibly extend a little bit in the middle area. I also noticed that the temporal area is a little bit hollow. She may evaluate putting a little bit more in the temporal area as well. Finally, we come to a small amount of volume on the lips just to create more rejuvenation, more in a restorative fashion rather than an augmented fashion. And then I believe that volume in the chin would improve her profile, especially if we're going to put a little bit in the lips. And then in the pre-jowl sulcus, marionette and lower marionette areas would improve the whole anterior jawline. And all these things together, well, we're expecting you to be how many years younger?
I'd settle for 5.
Okay.
Thanks, Doctor.
All right. Now this cheek is lifted compared to this cheek, and now we're going to blend into here. Okay.
They really do.
You see the orientation of your cheek now is this way.
Yeah.
This one is this way. So it changes the orientation.
Really
We've
does.
also, the lid cheek junction is blended. And if you notice the nasolabial fold,
Yeah, it's all lifted.
by virtue of putting volume here, we will lift up on that. So you see, now this projection and the nasal projection, because we're going to do the lips, will line up better.
More balanced.
More balanced. Now we're going to put a tiny bit here and here, because I like to get your chin to be more forward projecting. Do you see the projection on your chin? Look in there.
Oh yeah.
Do you see how it
Yeah.
makes your nasal and your whole face becomes more triangular, because we're
Going to.
tip defining here, here and here. So not so square anymore.
Yeah.
But I need to just now blend with this area. You should notice now that you are actually, remember this was quite prominent.
Yeah.
Now when you
And
bring
this is
this
much more
out, this
balanced.
becomes more balanced.
Yeah. I
Now
can really feel a
you
difference
should,
under as
you
well.
should possibly feel an improvement
Definitely.
in your neckline.
Oh my goodness, really? Wow.
Okay, so now the lips. I mean, you have quite full lips, so it's like 0.3, which is nothing. My average for most patients is 0.5 average. So here, turn for me a little bit. Let's go. So we can see we put, starting from the top, 1 cc in the right temple, 0.6 in the left, 1 and 1.3, 1.4 cc between the malar area and periocular, just 0.05 here, lips, 0.3, 0.35, chin was the main one, 1 cc and 1 cc. This was where you had the main volume. Almost 3 cc's in the lower face. Same on that side as this one, around 1.5 cc in total. And then that's it. So what's the total amount we used?
8.
So 8 cc.
That's quite a lot.
It is.